So good afternoon or good morning, depending on where you're joining us from. Welcome to today's national webinar presented by SAMHSA's Game Center with the support of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Today's webinar is utilizing family engagement to improve outcomes in drug treatment courts in research and practice. And our presenters today are Dr. Jessica Dahlgren and the Honorable Maria Elena Verde, and I will introduce them shortly. But first, I've just got a few introductory items to review. I'm Dr. Melissa Stein, a Senior Research Associate at Policy Research Associates in SAMHSA's Game Center. I go by pronouns she and her. And you'll see a chat box at the bottom of your screen. Feel free to use that chat box to introduce yourself, share where you're joining us from. I personally am joining from Charlotte, North Carolina. First, just want to be clear that the views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Throughout the presentations, we welcome your questions in regards to the content or your technology. Questions for the presenters will be addressed at the end of the presentation, and we'll address as many questions as time permits. You'll also see a couple of polls pop up throughout the event. To participate, just click your response and then click submit. And we really appreciate your participation in those polls. And you should have just seen a poll pop up on your screen just now. The webinar is being recorded, and everyone who's registered for this event will receive a notification when the webinar is posted to SAMHSA's YouTube channel. We'll also share the slides of the presentations to all webinar registrants in the coming weeks. At the conclusion of this event, we will share a certificate of attendance that you can download for your personal portfolio. We are not able to offer CEU credits. And we have arranged for ASL interpretation. Our ASL interpreters are Kelly Lon and Megan Thorpe. We also have live transcription from Zoom available. In order to see that, click Live Transcript CC, then select Show Subtitles. Just a quick look at our agenda today. We're going to start with some opening remarks from John Burke at SAMHSA, and then we're going to hear some information from Dr. Dahlgren regarding this topic of family engagement. And then Judge Verde will go into how they're using this in real time in practice in her courts. And then we'll end with plenty of time for some Q&A to answer some of your questions. But first, I'd like to turn it over to John Burke, who is the Senior Public Health Advisor at the Center for Substance Abuse Treatment at SAMHSA, and he will be providing opening remarks. John.
Thank you so much, Dr. Stein. I'd like to welcome everyone to today's webinar, Utilizing Family Engagement to Improve Outcomes in Drug Treatment Courts in Research and Practice. Thank you for attending, and I believe that you will find it very beneficial. SAMHSA is pleased to provide this webinar that focuses on the importance of involving drug court participants' families in the drug treatment court process and individuals' program success. SAMHSA believes that in a drug treatment court setting, involving participants' families and community can play an important role in increasing the participants' success in the program. Studies have shown that family therapy is related to reduced disparities in treatment court, as well as higher graduation rates and lower recidivism for participants. Involving family members also offers team members greater insight into the environment and characteristics of each participant, which provides a better opportunity to tailor treatment to a participant's unique needs. We believe that a client-centered, comprehensive case management plan will provide successful life outcomes. The positive impact of family engagement has been demonstrated to increase courts' cultural responsivity and support equity in the successful outcomes of participants across different racial and ethnic backgrounds. SAMHSA is truly invested in finding ways to improve equitable access and success in our drug treatment courts. In this webinar, our presenters will discuss ways that family engagement in drug treatment court settings can support the success of drug treatment court clients and their families. You will hear from our distinguished speakers, Dr. Jessica Dahlgren of MPC Research and the Honorable Maria Elena Verde, Miami-Dade County's Adult Treatment Court Judge, about ways that they have improved participant outcomes by incorporating family engagement in their standard court practices. I want to thank our presenters for sharing their knowledge and expertise with us today about this very important topic. And as always, I want to thank the Gaines Center and their staff for the work that they do in developing and facilitating today's webinar. So at this time, I turn it back to you, Dr. Stein.
Thank you so much, John. And now I'd like to introduce our speakers for today's event. Dr. Jessica Dahlgren is a research associate and project manager at NPC Research, and she has spent the last 10 years working with at-risk children and families to strengthen community involvement and wellness. Dr. Dahlgren's work includes children with incarcerated parents, children and family with child welfare involvement, and adults and families impacted by substance use. Dr. Dahlgren earned her Master's of Science in Human Development and Family Studies and her PhD in Human Development and Family Studies from Oregon State University. The Honorable Maria Elena Verde is serving her 11th year as a circuit judge for the 11th Judicial Court Circuit of Florida in Miami-Dade County. She oversees the Adult Drug Court and the Mental Health Diversion Program in the Criminal Felony Division and is backup judge for the Veterans Treatment Court. She was elected to the circuit bench in 2012 and was assigned to the Circuit Criminal Division in 2013 and the Circuit Family Bench in 2015. Judge Verde has been involved in training and educating judges over the years. She drafted a training course for judges newly assigned to Family Division and provided updates for the Judges Bench Book in 2020 and 2022. She was a presenter at the annual View from the Bench lecture in 2015 and 2020, and was on a work group tasked with developing remote procedures during the COVID pandemic in 2020. In 2022, Kidside Miami presented Judge Verde with the prestigious Maxine Lando Cohen Award in appreciation for the extraordinary service to the children in her community. So you've heard from who is going to be presenting to us today. Let's just check in to see who is joining us. And thanks so much to all of you who have said hello in the chat. It looks like a majority of you, this is not usually the case, but it looks like a majority of you are joining from rural locations. But that is very, very closely followed by urban. So it's pretty much an even breakout between rural and urban. And then about 21% of you joining from suburban locations. And we do have some people joining us from tribal lands. Welcome. And then in terms of agency and organization, let's see, it looks like a majority of you are joining from a community-based provider organization, but that is closely followed by corrections, probation, and parole. We're also seeing a good number of you joining from government and policy, as well as the judiciary. So thank you so much for spending your time this afternoon with us to learn about this important topic. Without further ado, I'm going to turn it over to Dr. Jessica Dahlgren to start our presentations.
All right. I'm going to say good morning because I am on the West Coast. I am joining you all from Portland, Oregon this morning. As Dr. Stein just indicated, my name is Dr. Jessica Dahlgren, and I'm a research associate at NPC Research. I do have to give a little asterisk about myself that I am 9 months pregnant. So if it seems like it's a little harder breathing wise to get up on my soapbox nowadays, that's because it is. And I'm very excited to join you for this topic today for family engagement, understanding how families support recovery. So why do we need families? The importance of human connection and family support. So where my work really lives is at the crux of child welfare and criminal justice. I started working with children of incarcerated parents 10 years ago and really realized the richness in the family bonds, and have since expanded to evaluation work with family treatment courts, and also work with All Rise and working with different courts to understand developmentally appropriate ways to communicate with families about addiction, incarceration, and time parents spend away from the home. Why does this matter? So human connection and substance use recovery are inexplicably linked. We as humans are neurologically wired for connection. And I'm going to go through this dense slide, and then we're going to break it down. So in brain imaging studies, perceived social isolation was associated with changes in connectivity, both between and within different portions of the brain, associated with diminished executive function, decreased ability to sustain attention, which impacts working memory, executive control, and maintaining task sets, and also hypervigilance to social threat and diminished impulse control. Now that's a lot of brain terms. So what this really means is when a person perceives that they are socially isolated, they do not have that social network connection, those positive support networks, it can diminish executive function. Executive function is a set of cognitive processes, sometimes referred to as self-regulation, that help us do the things that we really want people in our treatment courts to do, which is that stop, think, act, and plan. We want people to have that executive control that comes with calmness and engagement of the prefrontal cortex of the brain. And with that, we want to make sure that the social piece is there to help people sustain attention, right? They have to be able to pay attention to the treatment programs we're putting people through and the things that we're saying to them from the judicial bench or from attorneys or case managers. We have to be able to have them engage their working memory. And working memory is a really interesting set of cognitive skills, because what it basically equates to is keeping things in mind while then doing a task. So my favorite example of this is with children. And when you give a child a math problem, it often has multiple steps. And that child has to keep those steps in mind while working through the problem to get to the final answer. So understanding the importance of working memory in that planning piece and getting people to work through different phases of programs or recovery is really important. And that goes directly aligned with maintaining task sets. We know that our participants have to complete tasks that we give them. Showing up to treatment, showing up to get drug tests. They have to maintain those task sets and be able to complete things one at a time and keep those things in mind and work through them to be successful with their substance use recovery. Hypervigilance to social threat diminishes something that I'm pretty sure most people in the audience would have heard of, especially if you've worked with treatment court personnel: impulse control. We know that people with substance use disorders oftentimes have a really hard time controlling impulses, right? They are triggered by substances, they go to what works. That's very neurological. Our brains often go to the path of least resistance in terms of when we are under stress. And for them, that has been to use substances to reduce those hard feelings and circumstances that they're in. And we know that perceived social isolation diminishes that impulse control further. Human connection also drives behavior change through creating positive relationships. So we, as people who work with those in substance use recovery, can work to create positive relationships with those in the recovery to really be a source of accountability for their recovery. We can also use these relationships to emphasize belonging, and then use them to humanize others during times of both weakness and success. We can be this positive source of support for these people. And also, we know that recovery is hard and it comes with ups and downs and struggles, and how we can support people in their recovery during those times of weakness is just as important as how we can work with them during times of success. And as humans, we all make mistakes. We all have errors that we wish we did not commit and need forgiveness for. And so really using that mindset to connect with our participants or our people that are in our treatment programs, to connect with them and try to understand what they're experiencing in the moment. We can also acknowledge that shared humanity piece. We are all human. We all make those mistakes. And by working on these things and trying to connect with people who need that human connection piece, it's actually a really positive feedback loop, right? We're actually teaching them what appropriate human connection and positive human relationships really look like, which is important for continuing and sustaining recovery. So I like to call human connection the roots of recovery. And I like to think of recovery as this tree. And when we water the roots, when we have treatment teams or treatment court teams, good family support, friends, community engagement, that tree of recovery is able to grow. And when that tree is healthy and when there has been time put into that recovery process, we can see those positive outcomes, those fruits on the tree, such as sobriety milestones, increased child visits, or maybe even reunification with a child, employment or progress towards employment or education, maybe graduating from a treatment court program or a treatment session, treatment programs for the sessions that they're in. And in research or in other popular literature that you might have seen, those roots of recovery are often referred to as recovery capital. And recovery capital is defined as this collection of both internal and external resources a person with a substance use disorder can draw on to initiate or sustain recovery. So many people have heard of different types of capital, right? Educational capital, social capital. It's all about who you know and what you know. And you use those things to leverage other areas of your life. And this is the same for recovery capital. What are the things both internally, so values, relationships, understanding, and external, community engagement, religion, spirituality? What are those different resources a person has that we can then use to help catapult their recovery by integrating that knowledge and understanding of what they already are engaged with in their treatment? And that's basically what this box below says, is that recovery capital can be influenced by treatment professionals using strength-based treatment case management and therapy, and building upon a person's natural resilience and protective factors. For instance, if a person comes from a tribal nation and is seeking recovery, are we able to meet their needs with culturally responsive services? We know that the person might be very uniquely tied in with different leadership circles from their tribal nation, and are there resources in our community that can help offer them both what they need in terms of substance use recovery, while also further connecting them to their culture and things that already provide resilience and positivity and support in their life. And recovery capital can really include anything that promotes resiliency in a person related to recovery. And research looks at it with the lens of three main categories. So personal recovery capital, those physical pieces. Does the person have health, or are they undergoing maybe a chronic illness that needs to be addressed in addition to their substance use recovery? Are they safe? Do they have a safe and healthy environment to recover in, to live in? Do they have transportation to make it to their meetings or their drug tests or their treatment? And do they have financial resources? Do they have resources they need to provide themselves with healthy food or exercise equipment or the things that they need to rely on other sources of their recovery capital in order to promote that substance use recovery. We also have those human things: values, knowledge, education, and self-esteem. For instance, if a person has higher education capital, that could be used towards employment, towards seeking employment of a job that they're really invested in, which we know that that investment can be a huge source of accountability for people in recovery. The family, social, and recovery, or the family and social recovery capital, which is where we're going to live on my future slides, is really those intimate relationships that are supportive of recovery. And those family members being willing to participate in treatment can be huge. And also if the person has connections to conventional institutions like school, work, religions, church, whatever it may be, those are all huge sources of understanding the family dynamic, reducing stress, and then providing accountability for that recovery. There's also community recovery capital, which talks about those community resources, attitudes, and policies related to recovery. Does the person live in a community that supports harm reduction efforts that might be necessary for them to reach those proximal goals of just showing up, not necessarily being sober yet, showing up to meetings, whether they've used or not. And then also those culturally responsive treatment and support options. Are those available in the community? Because even if we know they need to be utilized, but they're not available, that can be a really hard challenge for people to undergo as well. And how do we mitigate that in terms of using things like telehealth or other resources we have to make sure that people are connecting not only with the resources that directly target their substance use recovery, but do so in a way that makes cultural sense for them. Okay, so back to that family and social recovery capital piece. Why are family relationships so important for recovery capital? First, and I think you can all probably attest to this, families influence a person's environment, and that can be either positive or negative. An example here is if a family member is actively using, that can be really hard for a person in recovery, and that can be a really negative environment for them to try to recover in. However, if a family is really positive and supportive of recovery and encouraging of the person to get and stay sober, that family support and encouragement can really assist in the process of recovery. Familial attitudes towards substance use disorders and the process of recovery are also influential, right? We need our families of people with substance use disorders to understand substance use disorders. And a lot of times that is difficult with the way that society views them. The research around substance use disorders is clear that that is a neurological process, that these people are sick. But that can be hard to both explain and to understand as someone who maybe has experienced, the negative impacts of a substance use disorder on their family directly. So we do have a few great examples from research here that improving family bonding is really related to increased recovery capital for those that participate in treatment courts. So we know that having that family support piece and those family bonds is super important. And family-centered therapy is one of the best approaches to substance use disorder recovery. So that's kind of a way that we can get there, is using those family-centered therapy approaches. And additional resources for children and family members can only benefit the well-being and health of a family as a whole. I like to bring this point up because oftentimes when we are serving adults who are in recovery, maybe we know they have children, maybe we don't. Those children often need a lot of resources. There are caregivers also due to the other family members that might not be engaged in substance use, but are still impacted by it. And the more resources we can really wrap around the family unit as a whole, the better that recovery experience is going to be for the person that we are really focused on, or who might be our drug court participant. There's also these really great findings about couples therapy, and that substance use disorders are more effectively mitigated by couples therapy than individual substance use disorder treatment. And this has a lot to do with modeling healthy relationships and also building those support networks and that human connection. So specifically, people that undergo family-based therapies or couple-based therapies have experienced fewer days of substance use, longer periods of continuous abstinence from substances, decreased incidence of adverse consequences of addiction, relapse mitigation, so that support is actually helping them from relapsing, decreased partner violence, right? That couples therapy piece, really understanding how to communicate, understand each other, and then de-escalate situations. Lower risk of child abuse. This is not a surprising finding either, because we know that child abuse and neglect often come from a difference in expectation between a child's needs and developmental stages and a parent's expectations of where children should be. So working together to get the family to understand where everyone is at and the role everyone plays in the family can be really important in lowering that risk of child abuse. Decrease symptoms of PTSD in veterans, improve family communication. That makes sense, right? More appropriate expression of emotions. So really teaching those increased problem-solving skills and teaching people appropriate ways to talk and act when they are stressed or in a problem or situation that could have been triggering previously for substance use. And then higher relationship satisfaction overall. So as my bio that Dr. Stein said read, I am a human developmentalist, which means I do take a dabble in theories every once in a while and really base kind of some things that we can do or know based on what theories tell us. And there are tons of theories on families and how families interact with and influence substance use disorder recovery. So family systems theory specifically tells us that working with the individual in recovery regarding their specific family system and involving other members of a family in the recovery process is a more holistic approach to recovery. So some things we can do. One, we can acknowledge that a person is part of a family system. People aren't operating in the world in isolation most of the time. And are we asking about who these family members are and how a person understands their place within the family? An important thing I like to bring up here is our treatment court participants, and I've heard this from more than one, will refer to themselves as, oh, I'm the black sheep of maybe all my siblings or my family or whatever. And that's really that learned helplessness piece, that low self-esteem of I can only do things that are incorrect. And so understanding how a person got to that conclusion about their dynamic in the family and their place within that can be really important for building up that self-esteem and breaking down that understanding of learned helplessness. We also really need to remember and encourage the understanding that family may not be biological. It may be chosen. It may be a roommate of 12 years or someone who has just been a mainstay in that person's life. So let's make sure to tap into those resources as well and not just limit families to that more nuclear definition or biological definition. And while all this probing can be done during individual treatment sessions, it can be even more impactful when we are talking about where everyone lives in a family dynamic as the family or the couple as a whole. Next, we can really work with someone in recovery to understand how they influence the family unit and how the family unit may influence them. It is often very hard to think outside of substance use when someone is in the thick of a substance use disorder. But we know that those actions that they take in that substance use is really impactful of those around them. And we need to understand how those family dynamics are moving around, to really understand that family behavior as the feedback loop that this person is encountering. We need to know how that loop is working. Again, is it positive? Is it negative? Or is someone using a substance and their family is always reacting in the same way of kicking the person out, taking away some safety and security? Or are they responding in a way that is helpful for sobriety, like returning that person to others that are helping them be accountable, like treatment providers? This can also be done during individual treatment sessions, right? We can really probe and help understand that family unit. But again, in family therapy sessions with everyone of the family there, it can be really impactful. And we can hear from all the different perspectives in that family unit. Next, we can work with the family to understand relationships, expectations, and communication styles. For this, I really feel that we need to utilize family therapy and other family-centered processes, that this needs to happen within that entire unit. And we need to work to improve familial communication and expectations to reduce stress and confusion for the person undergoing treatment. And what I really mean by that is I have found in my work with parents that are incarcerated or parents that are away for residential treatment or just away while they're participating in the program, maybe living somewhere else, they might have one set of expectations for when that family reunification happens. It might be, I'm going to return to my family, everything is going to be great, I'm going to get out of XYZ circumstance. And that's often not how that reintegration goes. The family is likely harboring burden, resentment, fear, whatever it may be that causes an incongruency of expectations between the person returning to the family living environment and the people that the person is returning to. So we really want to make sure, especially in a family-centered way, to understand who expects what from which party and how those reintegrations are going to go. And that's really going to help set the person who is returning back to the home environment. It's going to help set them up for success. It's going to reduce stress, which we know can be a trigger for substance use. So reducing that stress is going to be really important. And I did want to share a very specific research example done by a few of my wonderful colleagues at NPC Research. And that is that this family and domestic relationships counseling really works, especially in treatment courts. And treatment courts that offered those family or couples relationship counseling services had both higher graduation rates and lower recidivism. So the text is kind of cut off here, but you can see in the graphic that around 20%, there was around 20% recidivism for courts that did not offer that family and domestic relationship counseling, compared to just 4% recidivism for courts that did offer those types of counseling services. When I say recidivism, I mean arrests that they encountered after a treatment court program or finishing up these services. So there's a really big difference in the impact on recovery that integrating those families can have. Treatment courts also that offered these types of services had 5 times less racial disparities in graduation rates, because often when we're integrating the family, we are integrating those cultural pieces that are really important to the support and resiliency of that person during recovery. And I did also want to make a plug that the CDC agrees with this view that we should be promoting these healthy, respectful, and nonviolent relationships through the use of things like family therapy or couples therapy to reduce the occurrence of intimate partner violence and prevent harmful and long-lasting effects of intimate partner violence on individuals, families, and communities. And the way we need to do that is really teaching those safe and healthy relationship skills through those healthy relationship counseling for couples and socio-emotional learning programs for youth. So really making sure youth are learning important lessons earlier on in the pipeline before they make it to our treatment courts which can also be an argument for family therapy if children are accountable or accounted for. So next steps, moving forward, I would like you all to think about how you can advocate for more people around you to receive family-centered or relational-based therapy to improve their substance use recovery outcomes. We have a lot of great people in the audience today who are actively doing this work. So think about what your role is and how we can really advocate to increase the number of these services that are reaching people in active recovery. Thank you so much for your attention today. My email is here, and I am very happy to answer any questions via email that we might not get to in the Q&A today. My asterisk, of course, is that my maternity leave does start in about a week and a half. So if you have questions, don't sit on them. And if you do have questions later on, I will get back to you once my leave is over in mid-February. So thank you. And now I am going to turn it over to Judge Elena Verde from the Miami-Dade Adult Drug Court.
Judge Verde, I just want to interrupt and say you're on mute.
Oh, sorry. Okay. Okay. So good afternoon, everyone. My name is Maria Elena Verde. I'm coming to you from Miami-Dade Drug Court. And a little bit of background with Miami-Dade Drug Court. We opened our doors in 1989, and we all stand on the shoulders of Judge Stanley Goldstein, who opened the first drug court in the nation so long ago. And over the years, we've learned a lot from those first drug courts. At first, it was trial and error. So when we started our drug court program, no one really knew or had a role to follow or standards to follow. But over the years, we've developed best practice standards for drug courts, and we have adhered to them over the last 20 plus years, and they have proven to work. So we're an evidence-based program where we follow best practice standards. We adhere to assessments and the quadrants that follow those assessments, and I'll get into that a little bit later. So it's important to understand the difference between traditional courtrooms and our treatment courts, and what kind of changes we need to make in our thinking in order to properly engage in a treatment court. So my presentation is pretty much about taking all the knowledge that we know about the importance of family and putting that into action. So if you're sitting in another treatment court in any part of the nation, and maybe some things aren't clicking or aren't working for you, I want to provide a little bit of insight as to how we do it here that might be helpful to you. First thing I'd like to say is that my email information is going to be at the end of this presentation. And if you want to take a little peek into our courtroom, you can do so by Zoom. You can email my assistant, and she'll provide you with our Zoom information. So you can stop by and visit any day you want and take a look at how we do things here. And that might be helpful to you. You can also email me and I'll provide you whatever literature we have on best practice standards, or simply engage in conversation to see if there's an issue that you need some help on. We'll be happy to help. I think that if anything we got out of Zoom is that we can visit each other or attend court simply by sitting at our desk and looking at our computers. So I was an assistant state attorney for years. I was a defense attorney for even more years, about 12 years. And when I first was elected, I sat on the criminal bench, and then for 4 years. And then I was on the family bench for 7 years. So my mind frame when coming into drug court was very much the traditional courtroom model, where we have an offender who is accused of committing a crime. We have evidence that needs to fit into elements. Everybody has their role. There's the prosecutor, the defense attorney, and we don't fall outside those roles. So in order to better understand this presentation, I want you to put yourself in the position of someone who has recently been arrested for a drug charge, first-time offender, coming into this setting, and this picture is a little bit of a hint of what you see. You don't know anything about the criminal justice system. You've been accused of a crime. You spent the night in jail. And now you're walking into a courtroom where the judge sits up top, everybody's in a suit, and you don't know what's happening. It can be a pretty scary situation, and you don't know how to get out of it. Walking into a treatment court, if you've been properly referred into a treatment court from this formal setting, you're going to see things differently. So while we also have our roles within the treatment court, we rethink how we see things. So we have participants instead of offenders. We value family. We're a family-centered court where we understand that the individual doesn't come into our courtroom alone. Individuals bring with them all of their experiences, their culture, their religion, their gender, their family, their education, their trauma, everything that comes with it. And as such, we have to, at times, identify those needs and then properly address them. So a treatment court is going to be a lot more welcoming. We're not going to focus so much on what the accusation is and whether or not there's strength or weakness on that case, but the individual himself or herself and how to better address her needs. So each participant that comes into the treatment court, again, comes in with their own sets of experiences, and it's important to properly assess their experiences to be able to address them. So we have differences we all have: race, gender, culture, religion, socioeconomic status, mental health, personality, employment. In Miami-Dade County, we're very diverse. Each participant is as diverse as the next. We have a very large population of migrant workers that may come from Central America. We have a large population of immigrants coming from all over the world. We have a large population of African Americans. We have Cuban Americans. And each one of these participants within their own culture is different from the next. And we have the first thing we need to do is properly identify who each person is in order to better address their own needs. There can be no addressing of a person's needs without first identifying who this person is and how to better address their particular needs. Another way to see this in terms of family is the participants come in, and at the center of this frame is family stress. How am I going to do everything that I need to do in treatment court and still take care of my family? How am I going to be able to work? How am I going to engage in meaningful time sharing? How am I going to tell my family what's going on? Or if you've been displaced from your families, how do I reconnect? Every person comes in with their own set of backgrounds, but they also come in with their own set of stress. So again, we have all this information, and how do we put that into place? Here are some more typical concerns that people have. So I want you to imagine yourself, you left your traditional courtroom and you come into treatment court, and here's what you're going to hear from me. Welcome to the drug court program. We'd love to have you. This program is 12 months long. You will be required to come to court once a month where you will be drug tested. You will be required to attend outpatient treatment that involves outpatient counseling and group counseling and individual counseling. You're also going to have to be drug tested 3 times a week. You're going to be introduced to some form of fellowship, and you will be required to abstain from the use of drugs and alcohol during the entire period of time. So what are you thinking at this point? How am I going to get all of this done? I don't want anybody to know. I need to work. And I've had a lot of participants who haven't worked years, and the first thing people think when they're in treatment now is I have to work. But it's a real concern. I don't have a car. How much is this going to cost me? I lost my job because of this. How am I going to get another job? Will I get deported? Is this going to be on my record? What's going to happen to me? Some of the family related concerns are, this must be this person's fault. Either my mother's fault, my father's fault, or they're blaming me for what's happening. I don't want to hurt my family. My family doesn't know what's going on, and they probably do, but the participant is convinced that they don't. I'm ashamed to tell people what's happening. I need support. My family is done with me. How do I get them back? Or my family members are also addicts and they're in active addiction and I don't feel safe at home. Or someone in my family is abusing me and I need to be in a safe place. So a lot of our participants come in with some of these concerns or all of these concerns at one point or another. Common issues between them would be relief from stress, financial responsibilities, acceptance, and forgiveness. Each and every one of the participants that comes through the door wants to feel accepted and forgiven. They come with a set of experiences where they've done harm, where they've been harmed, and they need to feel safe. When we promise them a safe environment, we have to include in that plan the idea of facilitating a family acceptance of the individual and forgiveness as well. Without that, there can be no healing process. So in order to, what impacts the progress of individuals? Well, the ability to attend therapy in residential facilities, the focus on recovery, the internal acceptance and forgiveness, and less likely relapse. A person who is supported in their recovery process by their family is able to attend therapy more frequently, attend residential treatment, knowing that they have someone who is sort of watching over them and their belongings and their other family members while they're in treatment. This then allows them to focus on their recovery and their progress. It allows them to accept themselves and their addiction and move forward in their recovery, to forgive themselves and forgive others. And this in turn makes them less likely to relapse. So how do I do this? If you're in the treatment court, and I've been in the drug court program now for a year. When I came in, my mentality was very much that traditional courtroom role. I was of the impression that the judge is there to ensure that there is fairness and equity in the proceedings, but not to get involved in any other way. So if you're listening to me in another treatment court and you're wondering, how do I get this started, or how can I be more effective? I say the change starts with you. If you're a judge in a treatment court, the change has to start with you. Attend as much training as you can on best practices, and have that internal change in your mind where we need to address the issues that are before you and not in a traditional manner. Second, follow best practices. And best practices says, keep it simple. You are to have no more than 125 participants. In Miami-Dade County, we have 250 participants currently, but that's because currently we are undergoing a bit of a crisis related to addiction and drug consumption, and we're fully staffed at this time. So follow best practices, keep it simple, and keep it small. There are 3 things you can do to ensure family participation in treatment courts. 1, identify case-specific needs early. 2, make appropriate referrals and have resources. 3, include accountability and teamwork discussions with family members in court. So how do I do this, Judge Verde? You're telling me to do this, but how do I actually put it into practice? Well, we have to identify the issues. And how do I identify the issues? The first contact with the participant is with the judge. The person walks through the door and encounters you. So you're sitting there, and this is a wonderful opportunity not to interrogate the person, but to get a lot of information and make them feel at ease. We have someone in court who takes notes of everything that's happening, not just the court reporter, but one of our data processors takes notes to then pass it off to the assessment and the case managers. So we have the court personnel, someone taking notes, and I start off by saying, what's your name? Where do you live? Who do you live with? How long have you been there? Do you have children? Are you married? Do you have a significant other? Are you working? And this is not, again, in an interrogation mode. It's more of a conversation where the person can feel at ease. We're getting a lot of information about the person's history, their experiences, but also their family. I also ask them, do you have any family here with you? And about 60% of the times they do. I ask the family to come up to the podium. I say hello, and I say the following words. You are welcome here. You can come to court each and every time. We love to have you. We love to work with you. The second thing you have to have if you're going to properly assess the issues or identify the issues is a proper assessment must be conducted in order to identify cultural, socioeconomic, religious, and family issues. So here in Miami-Dade County, we have 2 assessors. You don't need 2 depending on the size of your drug court, but this is a step that cannot be skipped. And we're going to provide you with the different assessment tools that we use in Miami-Dade County that are available to all. A proper assessment will give you a range of a risk and need of each participant. Is going to tell you if they're high risk, high need, low risk, low need, or anywhere in between. If you're going to be effective in drug court, there's something I had to learn very early on, and that's I cannot help everyone. Drug court should be focused on high risk, high need individuals, because by spreading yourself too thin, you simply will be ineffective. So it's best to focus on your high risk, high need individuals. And the proper assessment will specifically tell me, what are the family issues? What referrals do I need to make in order to address these issues? A third way to identify the issues as they relate to family and everything else, frankly, is to have case managers conduct home visits and meet the family and establish a report to identify any non-disclosed issues. So we all know that participants don't come into court or even their assessments and tell you everything. Some issues have to be disclosed with time as issues come up or things happen. So you need to have some case managers, and understanding that there are staffing shortages and other issues we have to deal with. Case managers are an essential tool in identifying all these family issues because they're in a unique position to visit people in their homes and get that sneak peek into what's really happening in there. And a good case manager will be able to get in, observe the home, the family dynamics, establish a rapport, and start to gather more and more information. But it's not just the gathering information, it's also to put the family at ease and let them know that we're here to help and not to hurt. So these are the 3 ways on how to identify the issues that are going to come before you. Now, what are some of these issues that we're going to see? Well, they're based on things that we've already talked about: social and cultural, gender, so sexual orientation, family dynamics, socioeconomic, finances, housing, nutrition, medical needs, religion, religious conflicts with recovery programs, sexual orientation, family dynamics, immigration, undocumented immigrants, housing, work-related issues, insecurity, legal issues, U.S. immigration and customs, and personal history, trauma, domestic violence, separation. So all of these things are going to come up in your proper assessment, and in your home visits. I'll give you a little bit of an example of some of the things we see here in Miami-Dade County. So I don't mention participants by name, but we do have one particular participant who is a gay male addicted to crystal meth and has a very religious family who does not accept him as his true self and who associates his homosexuality with his addiction. We were able to pierce that disparity and that miscommunication that happened between them with proper treatment. But it all started here in court, simply by asking the participant to bring his parents to court. If he was comfortable with that, he did say yes. He could come into court and we could start making the referrals. I was able to speak to the parents and let them know that we treat addiction as a disease and that he needed our help and that he was going to be disclosing some specific information to them in treatment. And today they have a much better relationship based on acceptance and communication. And like that, we have many different examples that I couldn't share today because of the time limitations. So now that you've identified all these issues and you know what the participants need, how do I get referrals? Well, each referral base is based on what is available to your community. It's very community specific, but these are some of the things that you're going to need to identify in your community. First, family counseling. It's provided for participants with family conflicts, family members who are amenable to this service, and family counseling is given as an adjunct to trauma therapy and substance abuse treatment. So everyone needs to go to their substance abuse treatment. But in addition to that, family counseling is an essential tool. Co-parenting counseling. Delivery is pending approval of a Bureau of Justice grant in a partnership with Family Resource Center. So right now, we are pending a grant, but we're hoping to get this started. Co-parenting is essential for post-divorce or separated parents. Nothing adds more stress to a person than not being able to see your children or a separation. I spent 7 years in the family division, and I can tell you that the source of stress is tremendous. For someone who suffers from substance use disorder, it tends to be a trigger that will probably result in a relapse if it's not properly addressed. So it's imperative to have co-parenting counseling. The next counseling that is something that has to happen is trauma therapy. So about 70% of our participants have suffered from trauma. A lot of our participants are homeless, have been homeless for a very long time, and have been beaten, robbed, ignored, humiliated on the streets, and have been traumatized to a point that I couldn't even explain to you. Trauma therapy is specific to address these needs. It is imperative that you have some sort of resource where it can be properly addressed. Parenting classes are specific for, they're different than co-parenting in that it's just a class that would enable you to better address the needs of the children, and they're available throughout Miami-Dade County. Now, 12-step meetings in Al-Anon is something I wanted to address separately. In Miami-Dade County, we refer participants to 12-step meetings of their choice. So we refer them to either Narcotics Anonymous or Alcoholics Anonymous or Smart Recovery or any other 12-step program of their choosing, whether it be a faith-based or spiritual-based or not. And it's important that you give them a choice as to which one they want to participate in. I have made it a habit to send anyone who comes into court to Al-Anon if they're a family member, because we also need to address the issues that the families bring, their own sets of issues for enabling a participant to continue their drug use or making the proper separation or distance that they need to also heal. So these are the referrals that you could be making. These are other referrals, Incredible Years Weekly Toddlers Groups. So this might not be available in your jurisdiction, but these are led by specialists at the University of Miami, working within the Department of Pediatric Psychology and funded through the Children's Fund. They're open to caregivers for toddlers from 7 months to 3 years of age. They provide a total of 13 weekly sessions. They're taught in English and in Spanish. They're available at various locations in Miami-Dade County, including telehealth. And each week provides social, emotional, developmental behavior management and school readiness skill building. In addition, each week participants receive topic-related items and watch video clips of real-life situations to help improve child behavior. I wanted to say something about remote telehealth. This has proven to be a tremendous asset for us because we have a lot of people who can't make it to particular locations, and a lot of you are coming from rural areas where the distance might be great to travel. So telehealth has been something that has changed everything about the way we see things. We now have people who can live even out of the county, but go to our group sessions and our individual counseling through telehealth. So it's definitely a tool that you need to consider in order for proper management of the drug court program. Family Resource Center and Parent Education Program utilizes the Nurturing Parenting Program, which is evidence-based and designed to improve parenting skills for at-risk families, and it's funded by the Children's Trust. It's open to caregivers of children up to 12 years old. It provides a total of 16 two-hour sessions taught in English and Spanish, and it's focused to prevent the occurrence or reoccurrence of child abuse. Families are tracked and monitored up to 18 months after completion. So these are some of the different resources that we have here in Miami-Dade County. And if you have any questions about these specific resources or what you can do in your community, you can always email me and I'll be happy to work with you. And the last thing you can do to address the needs of your participants as it relates to families is include a teamwork attitude with families. So this seems pretty simple. How do I include a teamwork attitude with families? Well, I have the attitude. How do I get them to have the attitude? Participants are strongly encouraged to bring family members to status hearings. This is step one. You can't work with a family who is not present before the court. Now, even though I think it's better done in person at times when I have family members who are from other counties or other states, I do ask them to join us on Zoom, and I have found that it's a valuable tool. I get people to get to court more regularly, and I'm able to engage with them. Significant others and spouses are routinely asked at status hearings to provide a urine sample for drug testing to aid in the identification of treatment needs and ensure that participants are living in environments conducive to recovery. So this is a little bit tricky because I don't have jurisdiction over the spouses or significant others. And I don't want to put people in a position where they are afraid to come to court and participate. But at times it is necessary when I have a participant who is relapsing time and time again and they're at home. I need to identify if their spouse or their significant other is also their using partner. And at that time, I think it's appropriate to invite the other person in and ask them if they would like to participate in drug testing. Now, I don't have jurisdiction over them, but I do have jurisdiction over the individual. And I can always tell them that if I cannot identify whether or not they're using at home, then it's appropriate for me to ask them to be removed from the home and placed in a different treatment program. Family members are also asked to attend Al-Anon, and we've gone over that already. Case managers conduct weekly field visits with participants and family members to build a rapport and generate referrals as needed. We've gone over this, but there's something I'd like to highlight about this issue. This is exactly why we need to have a manageable amount of participants in our programs, because case managers, in order to be effective in their job, they need to conduct these weekly field visits. You can't do that if you have over 20 or 25 participants that you're overseeing. And participants with an open case and dependency court are assigned case managers in each court who regularly communicate. And this is essential. We do have a lot of participants who come to us with open dependency cases. And I have to work with the judge in the dependency court. And the case managers have to work together so we don't duplicate services. And we address issues that may not arrive in each other's plans. Family members are typically asked to attend on monthly graduation ceremonies. So I'd like to take this time to give you some success stories, and I'd like to start with a participant who was a 32-year-old Hispanic female. She was raised in a household with an alcoholic mother, a physically abusive stepfather, and was repeatedly raped from the age of 9 through 11 by a male family friend. She was arrested for selling Molly within 1,000 feet of a school and referred to a drug court program. She had a reported history of daily marijuana usage. She was currently raising 3 children between the ages of 10, 8, and 2 years old, with one diagnosed with ADHD and learning problems. She presented at first court hearing with the father of the youngest child who tested positive for marijuana. Both were promptly referred to and completed substance use treatment. She also completed weekly trauma therapy despite struggling to process her trauma. In addition, they both completed weekly parenting classes and utilized progress charts at home upon completion. They took the initiative to place her 2-year-old on the waiting list for the Children's Trust Early Learning Head Start program. And they reported positive family interactions, which were corroborated by staff. And now she maintained employment at Uber Eats for the past 2 years and continues on her progress to recovery. So we properly addressed the issues with her. We sent her to the proper referrals and maintained a connection with her and her family through the court staff and personnel, and were able to report that she remains in recovery at this time. And the last thing that you can do to help people maintain their path of recovery is invite them to the graduation. So we started our graduations after the pandemic last year, and I cannot tell you what kind of an impact that has on the participants. I know that not all treatment courts have a designated day for graduations, but I strongly encourage you to do so. I tell everyone that's going to graduate from our program, our graduation date is set as this date. Bring your family, bring your friends, and prepare a paragraph to let us know how this program has changed your life. We'll have refreshments for you, and we'll get to share some of the details of your progress. This has an impact on the participant because it's their day to shine. And who do they want to shine in front of? Not me, and not the drug court team, but they want to shine in front of their family. They want to show their family how well they're doing, how much they've changed, what the progress they've made. They want to feel accepted and loved. So it has a tremendous impact on the participants. It also impacts the family. It lets them feel at ease. It lets them know how hard the participant has worked, how well they've done, how many resources we have. And it starts to build that bridge of connection once more. The reinstatement of our graduations has helped us in our participants maintaining sobriety and recovery, in connecting between the family and the participants, and between us and our community. So it's a tremendous tool, and it takes really no time at all to prepare. So again, my name is Maria Verde. I'm happy to help you with any questions you have. I really would love for you to join us on Zoom anytime you can, just to visit and see how we put things into practice. And at this time, if you have any questions, I think we're going to go to questions and answer. Thank you.
Thank you so much, Judge Verde and Dr. Dahlgren. So as they have mentioned, we are going to move into some time for Q&A right up into the top of the hour. So if you have questions, feel free to submit them in the Q&A portal. And we do already have a few questions that have come in. So let's take a look at some of those. So, funding always seems to come up. So how do you pay for these things? And so someone did ask, when you say courts offer family therapy, do you mean that they pay for it, or is the court paying for it? So how do we, ensure that there is the funding to support this kind of family therapy? So, Judge, I'll start with you, and then Jessica, I also would love to hear from what you see across the country, what treatment courts might do to fund family or couples therapy.
A lot of our treatment is grant funded. So you need to apply for the proper grants. And then you can put those into practice by, for example, our SPIGA is grant funded, which is our trauma therapy. And with that, we will able to contract with some of the local providers to cover the costs of the treatment. We do have a county-run program, which is our DAP program. And we do a lot of referrals for outpatient and residential treatment there. And they also provide some family therapy and individual counseling as it relates to family. But most of our specific family and co-parenting and trauma therapy is by grants.
Yeah, and I'll echo that with just what I've seen doing various evaluations around the country as well. It is really reliant on grant funding. Either the funding that goes directly for overall court operations has some sort of allocation or budgetary line or restriction even for the types of treatment that can be provided or can be sought out, or you can seek out specialty funding to get additional resources accessible to your
Thank you for that. Another question that's come up a couple of times, I think, is more directed at Judge Verde, but certainly, once again, Jessica, would love for your input. So, bringing family members into the courtroom and having conversations, are there ever any concerns about confidentiality? And are there ever any concerns about it raising conflicts where maybe a family hasn't started counseling together yet, and there's still some misperceptions or misunderstandings? So I think this is two questions. How do you ensure confidentiality where needed, and then two, how might you address conflict if it arises when a family member shows up?
So it's important for the judge sitting in the treatment court to understand something I needed to understand early on, is that I am not a therapist. And I cannot act like a therapist. I am there to gather information and encourage the participant to move forward. And there's a line we don't cross where we start engaging in more of a therapy session, where I give advice on how to deal with a particular issue. So I should premise my answer with that. I usually ask the participant, is it okay to talk about this? Or, the questions that I ask initially are so general. Where do you live? Who do you live with? Are they here? I'm going to bring them up to talk to you. And if the person brought the family, then the family knows that this person's been arrested and that they're engaging in drug court and they're going to need treatment. They probably know a lot more about the history of the person than I do. So there's really no conflict there. I'm very careful to ask about specific things, just to keep that line, where I don't cross over certain topics. One, because we're in court and there's other people there and I don't want to embarrass anyone. So my initial role is just that of gathering information, making the person feel comfortable, and then addressing some of the issues that are pretty much known at the time.
And have you ever experienced conflict, or how might you mitigate some of those situations?
Okay, so we'll go back to the example that I gave of our participant who was, he was homeless, living alone, even despite the fact that he had family, because of his sexual orientation and his drug use. And there was a lot so the family was a very conservative, religious family, and they didn't understand a lot about the participant or his life or his addiction. So that was something that it shouldn't be properly addressed in court, because this is more of a therapeutic issue. But I needed to break the ice. I needed to bring them in and at least make their referral, and they wouldn't go unless they came to court. So I would say very delicately is how you address that. I don't have all the answers, but very delicately. So I had to, again, understand my role, which was to bring them in and let them know your son is in treatment. We welcome him in treatment, explain a little bit about the treatment that he was participating in, and then ask them if it was okay with them to go to a family therapy group. And they were okay with it. And once they got the information, there was a lot of healing that needed to take place, but we broke the ice and we planted the seed. And sometimes that's all you can do.
Thank you for that. Jessica, anything you want to add to those questions?
One, I just think that Judge Faraday's example was awesome, and great recommendations. I'll say that in the past few years, NPC did work on a COVID-related study where we interviewed as many BJA grantees as we could for different types of treatment courts. And I can really echo that research has found that having those family members at those graduation ceremonies and having that positive support has been so huge. And that really transcends, all sorts of rural, urban, suburban differences, and different types of court differences as well.
And so, I think that we kind of hinted around this, but some people are asking for more clarity. What do we mean by the family? And Jessica, you said one caution is they may not be what we consider in a traditional sense the family, but who are typically coming in the courtroom as the family? Is it parents, children, siblings? Who might we be looking for to come in as family members?
All of the above.
Yeah.
So we have, and then some people will say, my mom couldn't make it, so my sister's here. Or I was raised by my grandmother. Or this is my stepfather, and he's been, the person to take care of me. Or I have friends that have become family because my real family, so to speak, is engaging in behavior that I just can't be around. So family, it could be anyone.
So I think that's really important because we did just get a question. What about when the whole family is in active addiction or criminal behavior? And so if I'm hearing clearly, we're looking for the people that are in that person's life, hopefully in a positive way, but we are looking for people who are in that person's immediate life. And so if they are in active addiction, you are still inviting them in to perhaps receive drug testing, perhaps engage in some of the treatment offerings. Some people may have separated from their family because of those issues, and they have a different set of people around them to engage.
So we always encourage family participation unless it's unhealthy, in that the family members are engaging in active addiction and that's just not a healthy environment for the participant. At that point, if I'm unable to connect with the family, or our team is unable to connect with the family, that's the one time where we have to say, we need to put a little safe distance between you and your family members. And it's very hard because we have that need to feel connected. But then we can also look for maybe some healthy relationships in that person's life that can step in and take on the role of the traditional family members. So we do have situations where the family is just not healthy, and it's important that we create that distance. I did see a question that said, it read, and I'm back up for Veterans Court. In Veterans Court, you're in a different position because a lot of times the fellow veterans are closer to the participants than their family. There's a connection between veterans that's unlike any other participant. That's why we have our separate Veterans Court in Miami, because we have found that they rely so much on each other and really connect between each other more so than with people who are not veterans. So veterans can be if you're in Veterans Court and Veterans Treatment Court, the other veterans become your family.
Jessica, is there anything else you want to add about the family dynamics and things, precautions or strategies?
Just that, the important thing is to be there and available and get to know your participant enough to know what that support looks like, and to know, like Judge Verde was saying, where is that line between the supportive family and the family members that really might need more space to promote successful recovery. So really doing that investigative piece, and kind of harkening back to what I was talking about with family systems theory, knowing where people are, how are they situated in whatever they consider themselves to be the family unit, can be really important for understanding how they got there, where they're going with that unit, the support and types of feedback loops that they're engaged in with those people.
And I think Michael Miller says it very well in the chat: humanity plus common sense. So those are the two elements of drug court that you really need to have present: humanity and common sense. Sometimes it's just without it, there's no application of best practices or any type of court instructions. You just need that.
Absolutely.
And there have been a couple of questions that have popped up about various models or trainings. So let me see. And I do want to put a plug in that that is a topic that the Gain Center is contemplating providing more information around, because there are more models and other approaches that can support you in engaging with the families. And so one person, I've lost the question now that I'm trying to find it, they were asking about training for case management. And so I just wanted to ask Judge Verde, do you all have case managers? Do you train them in any particular case management model? What does that look like in your courtroom?
So we have 5 case managers who are full-time. We do strength-based training. And then we provide them with funds for training at All Rise and other local-based training. So yes, and we do in-house training as well. So we've been around for a while, so we're able to do a lot of in-house training as well. But I don't see how a treatment court can function properly without case managers. Otherwise, you just have the providers reporting to the court once a month. So you come to court and you have the providers reporting to the court, but there's no real connection between the court and the participant. It's just a third party reporting to you. So nothing really takes the place of a case manager. The case managers are the lifeline between the court and the participant.
Jessica, are there any particular trainings or models for case management that you would want to speak about?
I can also just promote All Rise. I know I usually speak there every year, so I'm around, and I am currently branching more into my own content area of the children with incarcerated parents work, which I think is really interesting, especially if you are a case manager that works with any sort of incarcerated individuals and works with visitation. Besides that, I would just echo what Judge Verde recommended. I do not work with case managers directly outside of an evaluation sense, so I would rely on her expertise for that, because it sounds like she has an incredible team built up in Miami.
There's one more thing I want to say. Let's say you're short on funding and you can't afford to hire as many case managers, there's also peer specialists. These are drug court graduates who have maintained sobriety and recovery for, after I would say about 2 years, or I mean, if you have to go lower, maybe 2 years or more. And they are different and unique in that they have been where the participants are right now. There is no substitute for that. That's my, I don't have favorites, but I really like peer specialists, because they're success stories that then reach back and do good for other people. How wonderful. How incredible do you have to be to get through all this big mess? And here you are, you're doing well. And now you're going to go back there and bring people forward. If you can't hire case managers, you could probably find grants or at least encourage your county to hire peer specialists. And that's, or you could also do an alumni recovery group. So we started an alumni recovery group where they're again in a unique position to help people, and that's free. Um, it's a fellowship, and I lend my courtroom twice a week to fellowship programs, 12-step programs that can come in, and it's a place where they can meet. And of course, I'm not there, and none of us are there, and they can use the space to do their meetings. So you can do that as well.
Mhm. Courts can also hire. I know that for the state of Iowa that I'm working with currently, they have hired people with lived experience to be on their court staff teams to fill those regular positions. And that has been really beneficial in terms of really infusing that lived experience perspective into different parts of the court and having it infiltrated in their regular funding stream.
That's wonderful. And I love that approach too, that we don't just have one position for people with lived experience. They don't always just have to be in that peer support role. I know some treatment courts, their clinical director is a person with lived experience of substance use disorder. So you can have numerous positions where people with that lived experience can come in and really strengthen your treatment court program. And so unfortunately, we are not going to have time to get through all of the questions today, but really appreciate all of the comments and questions. And if you do have ongoing questions, you can reach out to us. And yes, I just want to say thank you so much to Dr. Dahlgren and Judge Verde for sharing all of this critical information. It really is not just changing the people coming through these treatment courts, but their families as well. That's really a pathway to transforming our communities. So thank you so much for your time today, sharing your expertise and your experiences. So we're going to move to the next slide. We've got a couple more resources to share with you all before we move on with our day. First, the certificate of attendance. So there are some of you who would like a copy of this for your personal records. So just let's look in the chat. We're going to plop a link to this certificate directly in the chat. You should have just seen it land in the chat. Click on it and follow your computer's instructions for downloading this directly to your computer. And you will fill out the name and then you'll be able to save it for your records. You should have just seen another poll pop up. And this just gives the Game Center more information regarding how we can better serve you all. We take a look at this information and shape our webinar suggestions and to SAMHSA accordingly. So we really do look at this information to shape the information that we then later push out to the field. So we really would appreciate your participation in the closing poll. And if you haven't joined the Games Center's listserv, here is a shortened URL, or you can also use your cell phone to open up this QR code. And this will take you directly to a site where you can sign up for our listserv. We do push out a monthly newsletter where we try to feature innovative programs such as Judge Verde's and share more information and resources from the field. So if you're interested, please sign up for that. That listserv is also where you can learn about our upcoming webinars. And finally, if you have any ongoing questions, please do reach out to the Game Center. Our presenters also shared their contact information, but you can also reach out to the Game Center, and we're happy to also work with you through other questions you may have. On the bottom of the screen, we have the URL for the Game Center's website, as well as a toll-free number. So once again, thank you so much for your time. And we are planning to push out more information about common models. So some of you mentioned the craft model. Some of you were asking about curricula that are used for parenting. So we are planning to share more information around that. But thanks again to Judge Verde and Dr. Dahlgren. We really appreciate your time. Have a great afternoon, everyone.
Thank you. Thank you, everybody.
Thank you.
Bye. Thank you.